Thanks for staying with us. Now, like many across the globe, South Africans are grappling to take on the massive information on the coronavirus outbreak. Many will be feeling overwhelmed by all this information and scared of the ramifications for themselves, their families, and indeed the country. With more people entering into a period of self-isolation, this makes for a dangerous mental health cocktail. Let's pick the brain now of well-known clinical psychologist Bradley Daniels, who can talk to us around his speciality and how people can deal with issues around anxiety. I don't believe, unfortunately, we have Bradley just yet. If you just hold on and hear if we do have him. Bradley, thank you so much for joining us this morning. A real mental health cocktail, I think you'd agree, is what the whole world and indeed South Africans are facing as we enter into this increasing period of self-isolation. For you, what is top of mind of what people really should be looking out for in terms of how they are dealing with what they're facing?
Good morning, Marcel. I think the first thing I almost literally want to start with the words that we keep hearing, which is saying that people should not panic. And that's exactly right. So I want to just reframe that and say people should be concerned and be mindfully concerned about following all the regulations that are set out by the South African government and the Department of Health and the National Institute for Communicable Diseases. So having said that about people not panicking, so what we're wanting to do, we're wanting to ensure that people are staying calm while still being able to stay focused on following all the guidelines we are given with regards to how to best protect ourselves and others. Because what we're wanting to do is want to ensure that we don't turn panic into engaging the irrational mind. Because when the irrational mind is engaged, that's when we start seeing things like panic buying and poor judgment around making the right decisions with regards to how to protect ourselves.
And now that you've mentioned it, there have been so many people talking about what's behind this panic buying and indeed the things people are buying. Have you given any thought to what is behind those feelings right now and indeed those actions?
Well, the first thing is that it's very clear for us, panic buying is actually not psychosocially responsible, really. People should be buying what is their need and not more than what is their need. So, of course, I think one of the attributions we can make is that the panic buying specifically is stemming from this irrational fear and this irrational anxiety. But I think we have to keep reminding people that, that is actually not the best response we can have at this time. So, for example, what a lot of economists have told us is if people keep panic buying things like food, we may create an artificial situation where we may have food insecurity, which then creates other problems. I mean, as well as, what we've seen, for example, with this what people have now called liquid gold, any sort of sanitizer and those kinds of things. But the reality is buy what you and your family would need under sort of reasonable and rational circumstances. Because when we overbuy, we then make it more difficult for people who, for example, couldn't afford to buy bulk buying at this point in time. We make it difficult for them to keep themselves and their families safe, which in turn then even makes us that do have the sanitizer unsafe. So I think it's important that one of the messages we need to spread to people is, one, be mindful. And I think that word is very important, so to be able to stay in the here and now and focus on just what's happening here, without judgment. So what that looks like is when I reach on the shelf for 10 hand sanitizers, maybe I actually only need 5. So put the other 5 back, because the mindfulness is telling us to think that there is a larger ramification for us not considering the other people which are part of this pandemic. So, for example, one of the words I wanted to really get across is that this sort of pandemic has to be understood as a biopsychosocial phenomenon. So we can't only just look at the biology. We have to also look at the psychology and also the sociology of it all. So if I can tell you just some of the things that I've been seeing a lot in my practice particularly, and in my practice I've worked with this since about January. So in the practice there has been a readiness in terms of getting ready for disaster. And this is vis-a-vis working with some people internationally, working with some international organizations which obviously were in different places in January of this year. So in the practice, what we've seen a lot is most people who have had the adequate preparations. In other words, we've been talking about it in the practice quite definitively for at least the last four weeks. So obviously, when we had our patient zero incidents, people already had an awareness. And I think this is what I want to encourage basically all healthcare practitioners, but particularly psychologists, because we have the opportunity to ensure, one, that we are able to assess what are people's knowledges, what are their attitudes, and what are their behaviors. And that should be sorted out as a matter of urgency. So basically in this week, if those are not the conversations you were having with people, then it is time that you have those conversations, because it is around ensuring that we keep the public safe in that perspective. Then following on from there, what we see is there are three populations of patients that I'm sort of getting on the radar quite strongly. So one is people who are already anxiously structured, or indeed have already been diagnosed with an anxiety disorder. Those individuals are going to be raising their hands, fast and furious to say, I'm not coping, I'm not coping. But they actually are the easiest sort of profile to really manage. The next category are people who either have been diagnosed with obsessive compulsive disorder, that's a formal diagnosis, or perhaps people who have sort of, when we informally say, have sort of obsessive compulsive traits, but not meaning they have the disorder. So they will be likely to be quite distressed at this point in time. And in fact, if the distress is quite high, they may actually struggle to function, because they could find themselves literally washing hands for 23 hours out of a 24-hour day.
Bradley, if I could just come in there, because unfortunately we're running up against the clock. The one last question I really needed to ask you is, can we talk very quickly about the role of social media? I found myself yesterday saying to my mum, who obviously falls in one of the risk categories as a senior, she wouldn't like me using that on national television, saying, just take a break from the news, take a break from social media, go take a breath outside, or those who are watching, perhaps you'd want to say, go to a window or a balcony if you can. How important is it during this time to control the time that we spend on social media and information overload that we're facing at this time?
Absolutely. Balance, balance, balance. So social media must be used in a very stringent manner, both by those that are publishing. It has to be the correct information. As consumers, I think it's advisable for us to have mindful usage. So get the information you need and go and do something else. So, for example, I had said a couple of days ago when the government released a press release at about midnight, and I saw that a lot of people, which is fine, that's what needs to happen, but a lot of people started sharing that on social media, and I thought, these people are going to unfortunately struggle to probably sleep, and they're not going to have good quality sleep because they're engaging that at midnight when they're supposed to be sleeping. And we know that good sleep, good nutrition, some exercise, as well as the good social distancing is what is going to strengthen our immune systems and make us a little bit more robust as a population to be able to manage this situation.
Clinical psychologist Bradley Daniels on the line there via Skype, giving us some really good practical advice as we head into increased periods of self-isolation. I know he's also a biodanza instructor, so he'll probably also encourage you just to get some free movement going in the space that you have available to you as we try and keep ourselves both physically and mentally healthy. We thank him so much for his time this morning.